Occupational stress with an emphasis on mental health workers. Presented by Candace Patterson, Community Health Education Methods, HKH 516, Dr. Chad Murphy. Table of Contents. Intended audience. What is stress? What are some of the effects of stress? What are the signs of stress? How is stress a community health problem? Occupational stress. Stress among mental health workers. Writer's thoughts and references. The presentation is designed for mental health workers, social workers, doctors, nurses, and all people who suffer from on-the-job stress. What is stress? The term stress was coined in 1936 by Hans Sell. He defined stress as the nonspecific response of the body to any demand for change. The American Institute on Stress gives several different forms of stress. 1. Acute stress, the fight or flight response. 2. Chronic stress, the cost of daily living. 3. Eustress, which is positive stress. 4. Distress, which is negative stress. The stress that we most commonly deal with is chronic stress. Chronic stress is the stress that we encounter on a daily basis. This can include work, kids, or financial responsibilities. If chronic stress is not handled properly, it can lead to health problems. What are the effects of stress? The effects on stress on the body include headache, muscle tension, chest pain, fatigue, upset stomach, and sleep problems. The effects of stress on the mind include anxiety, restlessness, lack of motivation or focus, irritability or anger, and depression. Effects of stress on behavior include overeating or undereating, angry outbursts, alcohol or drug abuse, tobacco use, and social withdrawal. The American Institute on Stress gives 50 different signs and symptoms of stress. I will list the ones that are not commonly identified as stress related. Some of the signs of stress include stuttering or stammering, difficulty making decisions, forgetfulness, racing thoughts, tremors, trembling or falling, frequent urination, diminished sexual desire, impulsivity, teeth gritting or grinding, suicidal thoughts, excess flatulence, and frequent use of over-the-counter medication. Stress as a community health problem. Increased stress can make a person more susceptible to catching the flu, sore throat, headaches, and backaches. Stress can cause flare-ups of dormant illnesses and may make it harder to get rid of other illnesses. It becomes a community health problem when diseases are communicable and hard to get rid of. Occupational stress. Occupational stress is the response that people may get when presented with work demands and pressures that challenges their ability to cope. Occupational stress can lead to poor work performance, poor management, and lack of support from supervisor and colleagues. Stress among mental health workers. The following has been indicators in increasing stress among mental health workers: increased caseload, time management, inappropriate referrals, and safety issues. and that is continue with safety issues, role conflict, role ambiguity, lack of supervision, and lack of funding. Some of the writer's thoughts. Not all stress is bad stress. Sometimes stress motivates us to achieve goals and complete assignments. It is when we do not deal with stress is when it becomes bad for us. I can personally attest that working in the mental health field is stressful. Oftentimes you have your job to do along with the jobs of others. Currently I have my own job as an assessment counselor, but I find myself fulfilling the roles as a financial counselor, doctor, nurse, and family therapist. Although I am able to fulfill all these roles, my pay does not increase and my workload gets heavier. There are constant demands, and the demands seem to increase daily. I can relate. I can relate to occupational stress, and I can relate even more to mental health workers. With the government cutbacks in mental health, I believe that stress will get worse. It bothers me that the one industry that helps with stress related issues has nothing in place to deal with their own stresses. With the rise of health educators, I am hopeful that something will be implemented to decrease stress among mental health workers. This information was brought to you by Edward Bunnard and Associates, Stress and Burnout in Community Mental Health Nursing, the World Health Organization, the American Institute on Stress, Mayo Clinic, Andy Long and Associates, The Impact of Daily Stress on Health and Mood, Psychological and Social Resources as Mediators.